They're now going to privatise patient care in hospitals.
You're a mean one, Mr. Grinch.
They're going to sell your hospital to the corporate sector, and they'll make a good profit out of your hospital.
Well, basically we're trying to get a message to the public in regards to privatisation of Port Kembla and Shellharbour Hospital. We're strongly against it, the community's strongly against it.
If this private partnership were to go ahead, a lot of our services will go. This partnership will put services in place that make them money and get rid of services that don't make money. So services such as palliative, rehab, and these are services that our community highly depend on, and we don't want to see them go.
But what it means is that we've got a private operator out at Shellharbour. If it's a slightly complex case, you're going to be bundled into an ambulance, you're going to be shipped off to Wollongong. That puts even more pressure on Wollongong because you won't be profitable out there.
I became a nurse to do my job, to look after patients, not to be kicking them out when they are still not well enough to be going home.
There's been no clarity in which services will be given away to the private enterprises. The care of the terminally ill is urgent care. We must protect the rights of the dying in the Illawarra to receive the care they rightly deserve.
We're not sure to what extent the community are aware of the repercussions of the privatisation.
The generosity of our community helped build the palliative care unit in Port Kembla Hospital.
The miners in this region, not only did they lead the fight, but they levied their own pay. They docked their pay to pay for the wages of the nurses and the doctors in those new hospitals that were to be built.
They mentioned two hospitals for the reasons as to why they can do it. The one is Northern Beaches Hospital, and the second is Joondalup in Western Australia. Northern Beaches Hospital hasn't even been built yet. So to consider that as a metric of success is beyond me.
I want Mike Baird and Ms. Skinner to come down here and talk to us. Talk to the people in the hospital, talk to our community and understand what our needs are.
Santa came here, he's missing a leg. You know, he's also fighting for his own health.
So Santa, freeloaders like you from now on, come to Shellharbour, they'll boot you out when the funds run out.
We're all fighting for our rights. We're fighting to keep our hospitals public, and this privatisation is not going to happen.
We will save these 5 hospitals and we will save Port Kembla Hospital.
Well, here's the answer to all your questions. It's all commercial in confidence. Merry Christmas, suckers!
Whose hospital? I can't hear you. Whose hospital?